morning and welcome back to TRAXXfm. You're currently hanging out with me. My name is KG, and you know what? Today, Health on Traxx as per usual. And today is the 20th of January 2025. Another 9 more days to Chinese New Year. And you know what? I'm already feeling it. I was on the roads today, not much traffic, so it's also due to school holidays, right? But today we are going to be talking about something that's very important, especially for the children, and that is staying safe from HMPV. And talking to us about that today is Dr. David Ng Chun-Ern, and he's a pediatric infectious disease consultant with the Tuanku Jaafar Hospital in Seremban under the Ministry of Health Malaysia. Welcome to the studio, Doctor. How are you today?
Hi KG, thanks for the introduction. Yeah, I'm doing good.
And doing good. Solid drive from Seremban today?
Yes.
Yeah, even I drove from Tampin this morning. Not too much of a traffic.
Yeah, not too bad.
All right. So today we're going to be talking HMPV. Now, before we start, can we just have the full name of HMPV? What does it mean?
HMPV is actually the short form for a longer name of a virus called human metapneumovirus. It sounds like quite hard to pronounce, right? It's a mouthful.
Yeah, so that's why we put HMPV lah.
Yeah, can you say it? Human meta?
Human meta?
Pneumo?
Virus.
Human
Human metapneumovirus.
So the short form is HMPV.
Okay.
So this is not a new virus. It's first discovered in 2001, but it's likely been circulating around for decades. But it's gained a lot of media attention recently because of a surge of cases of HMPV among children in China.
Yeah.
So people are worried.
Whenever something surges like this in China, immediately we go to, oh no, COVID vibes again.
Yeah, people are worried. Can this be like COVID? Can this cause a new pandemic? But actually, prior to all of this media attention, have you heard of HMPV before?
Maybe. I can't remember it, but I remember when I saw HMPV, hey, that seems familiar. Could be other things, but yeah, go on, doctor.
Yeah, you probably heard of influenza.
Yeah, definitely.
Have
the
you
A's
heard
and the B's and the C's.
Have you heard of RSV?
Yes.
Yeah, so this HMPV is not as famous as influenza or COVID, but it's very similar to another virus called RSV. So they are from the same family, they have similar symptoms. So it's one of the common causes of respiratory infections in children. When I look back at the data from my center to see what are the common causes of hospitalization in children with respiratory infections, the most common one is RSV, followed by influenza, and then COVID-19, and then the fourth place, HMPV. And these trends have been roughly similar for the past few years since the pandemic. HMPV is like the constant fourth place finisher.
Yeah.
It's like Arsenal in the football league. Always the fourth place. Are they still the fourth place now?
I don't know. I don't watch football, doctor.
Yeah. I'm a Manchester United supporter, so I don't even look at the tables these days.
Yeah, they got beaten yesterday, 3-1.
No. But what I'm trying to say here is HMPV is not an uncommon virus. We see it year-round, and in certain months, actually, the HMPV emissions are even higher than COVID-19 or RSV.
Due to the environmental factors.
It's seasonal.
Yeah. All right, so HMPV has been around since 2001, and of course, I can understand why it's gaining attention ever since COVID-19. People are always on the lookout for something that could be on the same severe scale, but right now HMPV is taking the stage because it's obscure enough not to be known, but also famous enough to be known to those in the niche and to some of them in the media. So I guess the media is also one of the proponent of all of this hype. Now let's talk. I think you've already touched about the commonality of HMPV compared to other respiratory viruses like RSV and influenza coming in at a standard fourth all the time. Now let's talk about the spreading methods. How is HMPV spread?
HMPV is mainly spread by transmission of infected droplets. What this means is if a patient has a HMPV and they cough or they sneeze, they are droplets that fly. And if you're within a droplet range, and if you inhale these droplets, you can get infected because the virus can go to your nose or can go to your lungs. But the HMPV can also spread by touching of infected surfaces. So this means like if I'm a father and I'm having cough due to HMPV, I cough on the toy and or I rub my nose and then my hands have virus, I touch the toy. And then I pass the toy to my child. My child holds the toy, but now his hands are dirty. And the child then rubs the eyes, rubs the nose. And it can also be spread by touch of these infected surfaces. But the main mode of transmission, the main mode how HMPV spreads, is still by droplets when somebody cough or sneeze.
So it is air-based.
Yeah, it's very much like influenza, very much like COVID.
It's also as common as the normal cold.
Yeah, yes.
All right. So now we have already understood how the HMPV spreads. We know how common it is. And what we're going to do right now, Doctor, we're going to be taking a short break. And once we come back, we'll be talking about the symptoms and some of the differentiation methods to RSV, COVID-19, or even the flu, and also diagnosis. And also, if our listeners do have any questions, you can definitely ask so on our TikTok page, and we should be able to answer, especially if it's pertinent to the current topic that we have at hand. But right now, we're going to be going for a short break. We're going to be listening to a song. This is APT by Rose and Bruno Mars, and we will be right back with Dr. David from the Tuanku Jafar Hospital. Don't go anywhere. Hey there, welcome back. And we are currently talking about staying safe from HMPV, the current notice disease that is currently going around, especially after a surge in China a couple of months ago. A lot of emphasis by the media on this topic. And today we are talking to Dr. David Ng Chun-Ern from the Pediatric Infectious Disease. He is the Pediatric Infectious Disease Consultant for Tuanku Jafar Hospital in Seremban, Ministry of Health, Malaysia. Now, we had a question that it was quite general, but I think the doctor can just tell us about it. One of our ex-boxers that asked, she lost her voice but no cough, and she's asking, is there anything specific that she could eat to get healthier?
Well, if she lost her voice, maybe she can try some honey.
Ooh,
honey
yes.
is quite soothing for the throat.
Mm-hmm.
But if there's no specific
Medicine.
food or medicine that will help to you'll get better with time.
It is just your body's own way of getting
Yes,
better.
yes.
Right, yeah, but honey, don't get the fake ones lah. Very, very easy to get. Okay, well, anyways, doctor, let's talk about the symptoms. I think you did touch a bit on this earlier, but can we just, for our listeners, go back on the symptoms and how can people differentiate it from other respiratory illnesses that share almost similar symptoms such as the flu, RSV, or even COVID-19?
The most common symptoms of HMPV is like fever, cough, runny nose, and the most severe ones, they can have fast breathing or wheezing. But just by the symptoms alone, it's very hard to tell apart all these viruses. If you have cough, you might be having HMPV, you might be having influenza. So the only reliable way to differentiate them apart is by testing.
And this testing is similar to like the COVID-19 testing before?
Yes. So the testing is through a laboratory test. This is done through a swab from the nose or the mouth.
Okay.
Very much similar like the ones that we've gone through for COVID-19.
So in that case, once they test it, they should be able to tell you which is the disease that you have. If you have the common flu, if you have the RSV, if you have influenza, or even COVID-19 or HMPV.
Yeah. So yes. So if it's positive and it's positive for HMPV, that means you have it. But if it's negative, it doesn't mean that you don't have HMPV.
Okay.
Because you really have to see what test was conducted. Because some of the tests, they only test specific for COVID-19. Some of the tests is like COVID-19 and influenza only.
Yes.
So if it's negative, it doesn't mean you don't have HMPV. It just means you don't have COVID, you don't have influenza. So it depends on what test was conducted.
Right. So make sure that you get the proper test. And this is something they can request with the hospitals if you're there?
Not everybody that has symptoms need to be tested. Because the testing is usually we reserve it for those children with high risk for severe disease, or if there are severe infections that result in hospitalization. If they are hospitalized, we tend to test them. The reason why we test them in hospital is because we want to know which virus that the child has. Because some of the viruses, like influenza, we can give specific medications for influenza. So if we detect influenza in the child, we can offer them antivirals. And the other reason why we test children in the hospital is because when we can just group these children with same viruses together so that it avoids transmission of the virus to another child who doesn't have it. So in the hospital setting, yes, we test. But if the child is at home, the child is having cough but still playful, running around, active, it doesn't need testing. You can just watch and wait, let the body recover. He'll get better by himself.
This is something that the body can take care of its own. Are there any over-the-counter testers for this, for HMPV?
Yeah, there are rapid tests available. The rapid tests are such like the one we do for COVID-19, where you see 2 lines, then it's positive.
Yeah, like the pregnancy test.
Yeah, but it's not usually available over the counter. You have to see a doctor, and the doctor will do the testing.
Okay.
But there are such kits that can test for HMPV.
All right. So as you said, rapid. So you have the results in minutes.
Yeah, yes.
All right. So now we know how is HMPV diagnosed, and we know whether everyone's symptoms should get tested. When is testing particularly important?
So the testing is important if you are at a high-risk group for severe illness, or if you have a very severe infection that needs you to be hospitalized, then yes, you should get tested.
Okay, so this is under the purview of the doctor, of course.
Yes.
All right. And who is most at risk of severe illnesses from HMPV? And are children the only ones at risk, or should adults also be concerned?
Most of the time, even if you have HMPV, it's just going to be a mild illness and you will recover from the illness. But there are certain groups of population that if they get HMPV, they can be at risk for more severe infections. These tend to happen at the extreme of ages, such as the very young children or the babies, or at the other end, the elderly. You can also get severe infection if you have chronic illnesses such as asthma or heart disease. And the other group of children that can get severe infections are those with low immunity. Because some children, they are naturally born with low antibodies. If they get HMPV, they can also get a more severe infection. But the otherwise general population, if you're healthy, most of the time, even if you get HMPV, it's just going to be a mild disease.
All right, so it's nothing to be very worried about. You know, it's only under if you see it becoming severe, then you just bring it to the hospital, and the doctors there already have a SOP to treat this particular disease.
Yeah, so if the symptoms persist or the symptoms get worse, then yes, please do see a doctor. So the doctor will do a testing to find out which virus that the child has.
All right, understood, doctor. Okay, what we're going to do is we're going to take another short break, and once we come back, we'll talk about prevention, because prevention is always better than cure, and also your final advice for our listeners today. All right, so don't go anywhere. We're currently speaking to Dr. David Ng Chun-Ern, and he is a pediatric infectious disease consultant with the Tuanku Jaffa Hospital, Seremban, under the Ministry of Health Malaysia. Don't go anywhere. We'll be right back after the song. Welcome back, and today we are talking about human metapneumovirus on Health on Traxx, otherwise also known as HMPV. Recently, we were surprised because there was a surge of infections in China, especially amongst the children. And today, to talk about that, we have Dr. David Ng Chun-Ern. And we've already talked about most of it, but right now, let's talk about prevention, Doctor. How can we prevent HMPV?
HMPV is preventable through the same advices that we give for common other respiratory infections, such as keeping the hands clean. So we encourage the children to wash their hands frequently. We also want to avoid sick contact because these young children, they are at high risk to get severe infections. And the young child usually doesn't go anywhere, stays at home only, but they can still get infections. How do they get infections? It's because someone else brought the infection back home. So for example, if you have a young baby at home and you realize that the older sibling comes back with a cough, so we try to keep this child who is unwell away from the young baby. So this means you try to avoid the older children from kissing the young baby or sleeping together, because when they're sleeping together, they tend to be very close, and cough is very easy for one virus to spread to another.
Yeah, you see them in the middle of the night breathing on each other's faces.
And we also want to avoid bringing out the small infants to crowded places. Or if you have to bring your child to a crowded place, maybe you can wear a mask. And so these are some of the ways we can prevent HMPV. There is no specific vaccine for HMPV. It's not like influenza. There's influenza vaccine. But for HMPV, there is no vaccine available.
All right. And let's talk about the long-term effects of HMPV. Are there any long-term effects? Because as you know, with COVID, we have long COVID and all of that. But is there any long-term effects for HMPV, and can they be detrimental for a child down the road?
HMPV, if you get HMPV, most of the time it's just going to be a mild illness. You will recover fully without any long-term effects. But HMPV, the immunity is not long-lasting. It is not like chickenpox. If you get chickenpox once, you're unlikely to get chickenpox a second time round. HMPV is like COVID. You can get it many times, but chances are if you get it the second time or the third time, it's not going to be as severe as the first time.
Okay, understood. But as you know, the COVID virus mutated multiple times, and over each time it became slightly more dangerous or lost some of its efficacy and all of that. Is there such a thing that can be happening to HMPV down the road where we can see more severe variants of it?
For now, HMPV is the same HMPV that we have seen for the past many years.
For the past many years.
Yeah, so it's not
not likely lah.
So far, we don't see any danger signs of it mutating to something more dangerous.
All right, understood, doctor. So now, the biggest question of them all: treatment. What do you do when your child has HMPV? What does the mother or father do?
If the child has HMPV, the treatment is actually just managing the symptoms. That means if the child has fever, we give medicines to bring down the fever. We encourage the child to stay well hydrated. If the child can't drink, the child is very lethargic, the child needs to come to hospital, then we can set up a drip so that we can keep them hydrated. Some of the children, if they have danger signs like fast breathing, they also need to be hospitalized. So in the hospital, how do we treat is we give them oxygen. So the treatment is focused on managing all of these symptoms. There is no specific antiviral to treat this virus. And since it's a virus, it also does not respond to antibiotics because antibiotics only kill the bacteria. So HMPV, the treatment is just mainly supportive. All
right. So a lot of management. So especially, when do parents need to bring their kids to the hospital?
So the parents should just watch for all of these danger signs. The danger signs is one, if the symptoms persist. Number two is if the child is lethargic, the child doesn't want to drink, the child is dehydrated. And number three, if there's any fast breathing. So just watch if the symptoms persist, if the child is not feeding well, child's lethargic, or if there's fast breathing, bring to get tested. And some of them will end up hospitalized.
Doctor, when you say persist, right, how many days is that?
Most of the time, by the second or third day, things tend to get better. But if after a week, it doesn't get better, or if the child doesn't feel right. So most children, if you look at them, you tend to know whether they're well or not. If they're running around and they're still coughing, the chances are the child is still well. But if the child, he's just lying down on a bed, refusing to walk, refusing to play, and this is a sign that the child is sick.
All right, okay, understood, doctor. Now, before we end the interview for today, is there anything else that you would like to add for our listeners? Any take-home messages?
So take-home message is HMPV is not a new virus. It's been around for some time, and there are seasonal surge of this virus. If you get HMPV, don't be afraid. Don't panic. You just focus on managing the symptoms, give medicines to bring down the fever, watch for danger signs. The danger signs if you have fast breathing, if the child has poor oral intake and dehydrated. Most of the time, after a few days, it tends to get better.
All right. So very, very good. Thanks so much, Doctor. I think the myths behind HMPV, especially, you know, how media likes to portray things, rather than social media, the way they portray things is like the new COVID is already here. Be careful, shut your door, start buying toilet paper in bulk again and all of that. The thing is, it's not. It is a disease that's well documented, well controlled, and within Malaysia, our doctors are more than well equipped to take care of it.
Yes.
All right, Doctor. Thank you so much for coming in today. We hope to have you again in the future.
Thank you, KG. Stay safe, everyone. Right.
All right, that was Dr. David Ng Chun-Ern, and he is a pediatric infectious disease consultant with Tunku Jaffa Hospital, Seremban, Ministry of Health, Malaysia. And we spoke about HMPV today and how to stay safe from it. All right, even if you get it, remember, this is something that can be treated. But right now, let's get some music going, and I'll be back in the next hour. Don't go anywhere.